What you're gonna have the patient do is lay down on their bed, on the floor, if they can get up from the floor, any kind of firm surface that they can lay down on. They're gonna straighten out their bad knee, and they're gonna bend up their good knee. So if my right leg's my bad knee, I'm gonna bend up my left leg. I'm gonna make sure my toes are flexed all the way forward, and I'm squeezing this top muscle known as the quad. You wanna keep the knee perfectly straight when you're performing this exercise. What you have them do is lift the leg up about 4 to 6 inches off the table, hold for about a second, and you're gonna lower the leg back down. You're gonna perform 3 sets of 10 of this exercise. They're known as straight leg raises. So you would take a towel roll and roll it up as you have home, and then you would put it underneath your ankle. This is for a patient who is lacking some knee extension. So what you would have them do is try to straighten the knee out and push down into the table. If they put their hands right over their quadricep muscle, the VMO, they can feel it squeeze as you're pushing down. So you should see a contraction in the VMO. You hold for about 3 to 5 seconds, and you do 3 sets of 10. Let's have your patient take a pillow from home. They're gonna sit down on a firm surface. They're gonna fold the pillow long ways, and they're gonna put it underneath their knees. Then they're just gonna let their legs relax. You want them to point their toes up towards them, and then you're going to have them slowly bring their legs up until their knees are fully extended. They want to squeeze their quadriceps, the VMO at the top, which is this muscle right here. Hold for about 3 to 5 seconds, and then slowly lower their legs down. You're going to perform 3 sets of 10 of this exercise. This next exercise I'm going to perform are known as heel slides. This is to help promote some knee flexion, meaning the bending of the knee. So you have the patient sit on the table. They either can straighten out their good leg, or they can keep it bent. It's whatever is more comfortable for them. They're going to straighten out the bad leg and put a towel underneath the heel. You get a towel from home. What you'll have them do is keep their heel on the table, and then you want to bend up the knee and glide the heel along the table, trying to get the knee about 4 to 6 inches away from the buttock, or as far as they can go up where they can tolerate. You want to hold for about 1 to 2 seconds, and then you have them straighten the leg out all the way back so the knee is perfectly flat on the table. You want to perform 3 sets of 10 of this exercise. The exercise we're going to perform are called ball squeezes. This is to fire the VMO, which is the inner thigh muscles, to increase quadriceps strength. If you can use a ball at home, if you have a little ball, but most people will have to use a pillow. And what you do is you take the pillow and then you can fold it in half. You can have the patient sit on the table, and you bring both legs up. This exercise normally is performed with the legs bent, but if they can't tolerate that, they can also perform it with the legs straight out. I'm going to show you how it's performed with the legs bent up. So you bend both legs up, and what you do is take the folded pillow and you put it between your legs. Next, you have the patients squeeze their inner thigh muscles, pushing into the pillow about 1 inch. You want to hold for about 5 seconds, and then you have them relax. They perform 3 sets of 10 of this exercise. Performer called step-ups. The patient can use a stool. If they have a stool at home, they also can use a regular size step. What you have them do is they approach the step, and as you normally would go up on the stairs, they'd be up with the good leg, down with the bad leg, but we're going to have them go up with the bad leg, which I'm going to use my right leg for strengthening. What you have them do is put their foot onto the step, and they're going to step up, squeeze their quad muscle, so they're straightening out the knee, and squeeze their glutes at the top. And to step down, they're going to bend the knee and then step back down. You play 3 sets of 10 of this exercise. The exercise I'm going to perform are called wall sits. So what you have the patient do is back up against a wall so they feel the wall on their buttocks and their upper back. They want to bring their legs out, shoulder width apart. And what you want to have them do is squat down about 45 degrees. You don't want them going any lower than 90 degrees. You can have them hold it here for a few seconds and then go back up. Another thing you want to be conscious of is when they're squatting down, my knees are not going over my toes. You want to perform 3 sets of 10 of this exercise. The next exercise I'm going to perform is an active assisted exercise to promote knee extension. What you're going to have the patient do is sit at the edge of a bed so that their feet are off the ground. Next thing you're going to have them do, if my right leg is the injured leg, I'm going to loop my left leg under the ankle of my injured leg. The next step is to slowly use the left leg to bring the right leg, raise the right leg up until it's full extension. At the top, you want them to squeeze their quadricep muscle, so they should see the muscle squeezing on the top of their leg. Hold for a few seconds, and then slowly lower the leg down. You can perform 3 sets of 10 of this exercise. We're going to perform our patella mobilizations. So what you have the patient do is put one finger right below the patella bone and then one finger right above the kneecap, which is the patella. As you push upwards with the thumb on the bottom of the kneecap, and then relax the thumb and you push downwards with the thumb on the top of the kneecap. The kneecap should move up and down. You don't need to use much force when performing this exercise. The calf stretch. What you're going to have your patient do is go up to a wall. If my right leg is the injured leg, I'm going to place my forefoot up onto the wall. The next step is my heel being dug into the floor. I'm going to lean forward until I feel a stretch in the back of the calf. You want to hold this for about 30 seconds, and then you can relax the knee. With this exercise, the leg should be perfectly straight. I'm now going to demonstrate an ITB, iliotibial band stretch for the knee. So you can have your patient sit on a firm surface. The firm surface has to be on a table or on the side of a bed. You're going to have them lay down on the non-involved side so that the injured knee is on top. You're going to have them lay on their side. They're going to take their top leg and slowly bring it behind them, keeping the toe pointed downwards, and then they're just going to let it drop. It's very important that you make sure that they keep their hips forward, and they should be feeling a stretch on the outside of their leg. You want to hold this stretch for approximately 30 seconds, and you can do it up to 4 times. I'm Christine Kilbride from University Orthopedic Associates.